This video lecture is going to cover more diseases and disorders of the integumentary system, primarily taking a look at tumors and pigment disorders. Now, as a quick reminder to you, the skin, we can divide that off into an epidermis and a dermis. The epidermis is the epithelial tissue that's constantly dividing from the basal surface towards the apical, sloughing away, constantly giving you a fresh outer surface. The dermis down below contains all the fancy stuff in terms of glands, blood vessels, nerves, hair follicles, most of your sensory receptors. That's all the tissue down here. Most of the tumors that we find in skin are going to be found out here in the epidermis. And so when you take a look at a benign tumor like a skin tag, what you're seeing is usually something that sticks out like this. And basically, a skin tag is, it's think of it as almost like a non-infectious wart, because what has happened is your body has had some trauma. These occur in places of constant abrasion, like the neckline, down here in the axillary region along the belt line. And so there's been some little trauma that has caused some cells in the skin here to die off. And instead of easily getting chewed up by phagocytes, fibroblasts come in and lay down a little core of collagen. And then the skin cells grow around it and form this bulge sticking out. And so you wind up with a hyperplasia reaching above the apical surface, sticking out like we saw with a viral infected wart. And it'll slough off, and occasionally someone will sit there and try and like break a piece of it off. And if that little kernel stays down there and doesn't get pushed out with the rest, it's just going to grow back like a wart. So generally speaking, you know, a dermatologist will have to go in and will have to cut down deep enough to try and remove that little core, that little kernel, and that'll get rid of the skin tag permanently. Now, a nevus, N-E-V-U-S, a nevus or a mole, that's a benign tumor of melanocytes. Remember that melanocytes are the pigment cells in the skin. They produce melanin that helps to protect your skin cells from ultraviolet damage. And so those cells are scattered all throughout the skin here. But occasionally what will happen is you'll have a melanocyte here that becomes a little neoplastic, and it's going to multiply divide to the point where now there's a whole mass of them making a large concentration amount of melanin. And so that's going to be our little benign tumor. It'll grow a certain size and then stop. And we'll keep an eye on it, make sure it never grows too big or it starts to grow deep or change its surface or anything like that, which could indicate possible malignancy. But this is otherwise a very benign condition. Now, you'll occasionally hear someone talk about an atypical nevus. An atypical nevus at first glance doesn't look as harmless as a normal nevus. And it's just simply going to be a slightly different type of neoplasia. But it's still considered benign in the fact that it has a certain size, a certain texture that doesn't change. And so the patient, when you see something like this, that's where you're going to want to talk to the patient. Has that changed? No, it's been like that for years. All right. You may still decide to scrape off some of the cells and have them biopsied to look for some dysplasia. But it's one of those things to bear in mind that just because it looks like this doesn't immediately mean that that is malignant. Now, another type of benign tumor we find in the skin, even though I just mentioned all about the epidermis, are hemangiomas. Blood vessels down in the dermis can overgrow and form little clusters of blood vessels. And so that'll bring more blood to that area, which causes a reddening of the surface. If you have a port wine hemangioma, what you're finding here is usually a dark red, a blue, or a purple birthmark. This is due to a benign tumor of veins. And so bringing the deoxygenated blood, so something probably pressed against her face. Very commonly, we find these as a congenital event. She was leaning against, the edge of the womb, or, something may have pushed a hand up against that long enough to cause the body to react by growing extra blood vessels under the skin to deal with that pressure. And so it results in this very benign condition. A strawberry hemangioma, these are going to be benign tumors of arteries. And again, what you see here is the umbilical cord had wrapped around this baby's arm while it was in the womb, squeezed it enough that the body responded by growing extra blood vessels to try and push the blood through this compressed area to keep the limb alive. Once we peel off the umbilical cord and deliver the baby, everything's fine. In time, a lot of these will regress. The body realizes I don't need so many blood vessels. You know, if you want, you can do surgery to burn away some of those extra blood vessels if you want to try and get rid of some of them more quickly. But in most cases, this is a completely benign, non-emergent condition. A cherry hemangioma, these are usually small little bright pink ones. These are due to small capillary beds that have grown into large clusters. Think of it as almost analogous to a dermal blister. And so it'll be this tight little packet, almost like a tiny little hematoma, almost a little pocket of blood. But it's not. But the blood is all in vessels. There's the difference. The hematoma is a pocket of actual blood. This is going to be a little cluster of blood vessels, but it's usually so tightly packed that if you did try to like cut this, it would just bleed massively. All right, that's our benign tumors. For malignant tumors, we're looking at cancer. We're going to look at the two most common types are basal cell carcinoma and squamous cell. Basal cell carcinoma is the most common type of skin cancer. And what you're looking at here, the difference between basal cell and squamous cell, basal cell carcinoma will start at the basal surface of the epidermis and grow outward. Squamous cell will start at the apical surface and grow inward. And so basal cell, luckily, is kind of self-limiting. It's growing away from the dermis. The squamous cell is growing inward, where, God help me, it could reach lymphatic vessels or blood vessels, and it could metastasize elsewhere in the body. If you take a look at these on a patient, I'll show you an example of a basal cell carcinoma there and a squamous cell carcinoma there. At first glance, you're not going to be able to tell the difference. That's where you're going to have to do a little biopsy, and an oncologist will look at it under a microscope, a pathologist, and they'll be able to identify by the various types of dysplasia if it's a basal cell or squamous cell. If it's a basal cell, we can take our time treating this with some chemotherapy drugs, maybe a little bit of surgery, possibly a little bit of radiation, maybe not. Squamous cell, we're going to be a lot more aggressive. We're worried about gouging its way in, and so we're going to be we're going to be doing serious surgery and some hardcore chemo to try and treat that. So our treatment plan will be a lot more aggressive. Actinic keratosis. Very common. Actinic keratosis is very common in older individuals, usually middle-aged or older, and usually fair skin, very pale skin. This is going to usually be found in areas that are exposed to sun a lot. And so it's going to be on areas along the face, the neck, the upper limbs. And so it's just simply it's going to be little benign cancer. I'm sorry, benign, or no, sorry, not benign. It's little skin cancers that are a result of constant sun damage to those cells. You have a lack of or a reduction of melanocytes, and so these are more prone to UV damage, which could lead to neoplasia. And so we'll have to find these little lesions, biopsy them, look under the microscope, find the dysplasia, go in and cut them out. Usually they stay very superficial, so surgery is usually a good fix. Got to catch it early before it tries to grow deep. Kaposi sarcoma. Now that one is going to be a connective tissue cancer. This usually occurs in the dermis and grows outward. You see a little eruption right here. It usually looks like strawberry jam. This is one that I talked about with you before when we talked about patients who are immunocompromised. The Kaposi sarcoma is the type of cancer that in an otherwise immune normal person would be able to surveil and destroy this before it becomes too bad. But this can spread in a person who has a weak immune system, for example, an AIDS patient. And so we'll see these little red eruptions sticking out of the skin. And that's a good indication that their immune system is not doing well. There's another example you'll see along someone's ankle. You see all these little red lesions coming out. And so obviously we got to treat the cancer itself, but we also have to be treating the immune problem. Melanoma. Okay, holy crap. Melanoma is the most malignant, the most metastatic cancer in the body. Melanocytes by nature like to crawl around, divide autonomously, and so if they become cancerous, they're that much more prone to traveling and dividing. And so melanoma is the most malignant and the most metastatic cancers in the body out of all the organ systems. We'll see these dark little spots show up anywhere in the body. They will migrate internally, so you'll get melanomas buried into the liver, spread into other organ systems. Yeah, these are nasty. These are nasty. Dear God, look at that one. One of the worst pictures I got this whole semester. Look at that. Look at that big ass tumor. Jesus. Now, what's really freaky, not only the fact that this thing had to have taken months and months and months to grow, and the person was just simply probably bedridden and didn't go in to get it treated for a long time, holy crap. But also, generally, the sole of your foot does not have much in the way of melanocytes. That means this was a metastasis from somewhere else. So somewhere else, you developed a melanoma that spread here and grew this, oh my God, thing. Yeesh. That's just nasty. Shake that one off. All right. Well, I want to talk about pigment disorders. We've been talking about those melanocytes. We've been talking about how the melanocytes are found out here in the epidermis. They're helping to protect your skin. They will make melanin, which will act as a sunscreen to protect your other skin cells. You can have different pigment disorders by having too much pigment or not enough pigment. And so if we take a look at a situation where there's not enough pigment, we can look at either albinism or vitiligo. Albinism is a hereditary condition where the person lacks melanocytes. They simply don't make functional melanocytes. The rest of their skin is perfectly healthy. They simply don't have the melanocytes. So it can be very pale. And you know that melanocytes give the dark color to skin, dark color to hair, and helps to pigment the pupil or the irises. Excuse me. And so these individuals don't have any of those. So they are at more risk for UV damage to skin. But other than that, the skin is otherwise healthy. This is hereditary. It covers head to toe from birth. Compare that to vitiligo. Vitiligo is a progressive loss of melanocytes, a progressive loss. And so usually around puberty, the melanocytes will just turn off in patches of the skin. Down here, the wrist, this is the natural pigment color for this person. And in these areas, they basically kind of bleached out. And so the melanocytes have just stopped functioning. Otherwise, the rest of the skin is perfectly healthy, but you have these spots that suddenly have no pigment protection. And you can see all sorts of interesting patterns form in certain individuals. All right, that's reduced pigment. We look at increased pigment. What we're looking at is something like this. Now, with ephelides are where you have, it's where they're referred to as acquired freckles. These are not hereditary. These are due to sun exposure. And so when you get enough sun damage that causes those melanocytes to freak out and decide, I'm not enough for this skin, I'm going to divide and make more of my buddies, you're going to get all these little clusters that make dark little spots all over the place. Those are going to be ephelides. And so these will cause dark little spots because of constant sun exposure to the point of having probably sunburned several times. And you can find examples here. And so Morgan Freeman is a good example showing you the ephelides across his eyelids and across his brow, and I mean his cheekbones. Excuse me. Lentiginous are dark spots also due to sun damage. The big difference is that ephelides usually are multiple all at once. Lentiginous are going to be single ones. And so usually these will have occurred from a single exposure, enough sun damage that damaged, a couple of melanocytes here or a couple of melanocytes here. Instead of sunburning the whole arm, it caused just enough damage that most of the skin was able to handle the damage, and a few of these wusses didn't. And so they freaked out and caused this. Now, it can, over time, having a whole lot of these. So this individual probably lived in some area where they have a whole lot of sun, and they just didn't, protect themselves and cover enough that over time they just accumulated a lot of these, a couple at a time, year after year after year. So you can have multiple antigenes at once, but each one technically is its own unique pathology. Melasma is an increased pigmentation. This was not due to sun exposure. This is due to hormonal imbalance. And so it's usually due to estrogen. And this is something that can appear either at different stages of the female reproductive cycle. She may suddenly have a little bit of a darkening along the face at certain times in the cycle, then will pale back. Or a lot of times you'll have some pregnant women who will suddenly have their face get darker and not usually uniform. It's usually, like I said, in spots, big areas like you see on the left picture here. And then after they're done being pregnant, it'll usually fade back down. So there's some kind of hormonal interaction with the melanocytes. Now, I mentioned birthmarks before. There are vascular birthmarks. We already looked at the hemangiomas. There are also pigment birthmarks, and these are due to pressure in the womb. And so Mikhail Gorbachev, and so he must have been headbutting against mom's womb inside, putting pressure on that part of the skin, and the body's response to that pressure was trying to push some extra blood flow, but also stimulating melanocytes, and so it caused that darkness along there, and so it created this dark pigmentation that is not vascular. And so it's not hemangiomas, those are pigment issues. Totally benign, totally benign. All right, flung a lot at you in terms of tumors and pigment disorders. Again, watch the video several times, read the book several times, practice with scratch paper, flashcards, make sure you get the terminology down. Good luck.